Often people come to counseling to try and figure things out. Imagine your life is like a box full of different things. We will go through each trying to decide what we want to do with them. Do we need to keep them? Do we not need them? Or are we unsure? What new things we do, we may need to add. The things that we don't need, we will get rid of. The things that belong, we will start to arrange them in a box. And we will talk more about unsure things and figure out where they go. As we learn new things, we will keep putting them in the box, adjusting things along the way. Okay, so you encounter a problem with a couple of different solutions. Which one is best? Here's how we'll figure it out. We'll look at each possible solution, list out pros and cons. Suppose you have two. We'll look at option A. You and I will discuss what the positives are of that and what the negatives are of choosing that. And then we'll look at option B and we'll do the same. We'll look at what the positives are of doing that and what could happen negatively. And that will help you decide which one is better. Then we'll go ahead and try it. Remember, if you change your mind, that's perfectly fine. Suppose we learn something new, we'll just add it and reassess the situation. So you learn new information about something, that's fine. Fourth, therapy. This is the time of exploring and learning about yourself. Looking at things in new and different perspectives. Counseling is a safe environment to try new things, test ideas, and make mistakes. No one judges you. It's a place for open and honest feedback. The counselor may be your first test before you go out and try something in the real world. For important or difficult situations, we may role play in the office to give you a chance to really experience it. Everything we do in therapy relates back to the treatment plan. It keeps us focused. For the past few weeks, we've been discussing that this would be our last meeting. How are you feeling about that? Well, I'm a little nervous. I'm unsure. I'm going to miss you. It's natural to be nervous. And honestly, I'm going to miss meeting with you too. We've worked together for a while, and I've seen you struggle once in a while. But I've also seen some great progress. You seem to become more confident with your choices now. So if you need anything from now on, just let me know. Take care. Finally, termination. Really, termination started back at the first visit. The whole time we are working toward this final goal. It's similar to high school graduation. You've done all the work, and now it's time to celebrate and move forward. We talk about how to continue to take care of yourself. Things you need to continue to do. New skills that you've already learned. And who are the people that you can rely on for support? I would like to briefly explain the different mental health clinicians that you may work with, their specific roles, and areas of expertise. First, a case manager. They tend to have a BA or a BSW degree. Their primary role is to coordinate the case and assist you with follow-through. A counselor or social worker may have an MA or an MSW degree. Their primary role is to provide therapy. A psychologist may have a degree of a PsyD or PhD. Their area of expertise is testing, and they also provide therapy. And lastly, a psychiatrist. Who's a medical doctor. Their primary role is medication, and secondarily, they provide therapy. I would like to review a few issues to consider. Look for a qualified mental health clinician. Qualified means they've had additional training in a specific area. For us, that means deaf and hard of hearing people. It is important that both the hearing clinician and the interpreter have had additional training. Clinicians need to be trained in how to work with deaf individuals, cross-cultural issues, and how to properly and effectively use an interpreter. Interpreters need to be trained on interpreting in mental health settings, how to work with clinicians, and how to work with deaf and hard of hearing consumers with mental health problems. There are clinicians who work directly with deaf consumers. Either deaf themselves or hearing who sign competently. Ask about their background and training in working with deaf people. If the hearing clinician says, "I've had 1 or 2 sign language classes," or "I've worked with many deaf before," that's just not good enough. Either way, communication happens directly or with an interpreter. It is important that you find someone who understands you and your perspective, and that you feel comfortable with that clinician. Lastly, what's discussed during your meeting with a mental health clinician is protected by law and is confidential. Your information cannot be released to anyone without your permission. But I will warn you, there are specific limitations to confidentiality. If the clinician feels that you are in danger to yourself or others, if there's a reasonable suspicion of child or elder abuse, or if served with a court order, the clinician, by law, must disclose your information. Counseling is an active process. It focuses on you as an individual and your specific needs. Change is not easy. It requires commitment and hard work. With that, you will see the benefits. If you have questions about counseling, how it works, or how to find a qualified clinician to work with, contact Project Endeavor.